husband and I tried to have a baby for many years without any success. I'm just the kind of person who overthinks everything. After the delivery and I had some complications, I had lost a lot of blood. I really wasn't making much milk. Mom guilt does not go away. Sometimes you'll make great decisions, sometimes you'll make bad decisions. Kids will be okay. Relax and kind of just enjoy them.
Today's guest is someone whose story deeply resonates with a lot of women, including me. I'm here with Teresa Wong, who's the author of Dear Scarlet. Her book, Don't Just Tell Stories, they name the emotion which a lot of us carry very silently, about postpartum depression, emotional load, loneliness, grief, and also how to rebuild oneself. Hi, Teresa. Thank you so much for joining us today.
Hi, thanks for having me.
Yeah, thank you so much. So I just recently read your book, and the first thing which stood out was the honesty. So you've literally explained postpartum in a very raw, unfiltered, and giving us an unflinching truth, and which very few women talk about it. So what I want to say is, so some women grow up wanting to be a mother, while for some, it's just a gradual process after having the baby. So it's a skill which both of them learn together. So how was that moment for you? So what I understand is you were pulled into it before you were actually ready for it. So there was a lot of uncertainties.
Yeah, I mean, I'm not sure I would have ever been ready for it is the thing. I had a lot of apprehension before I got pregnant, and then my husband and I tried to have a baby for many years without any success. And so when it actually happened, it was like kind of a big surprise. And I'm just the kind of person who overthinks everything. And also I had a life, like I had been, I had a career, and I had been married for a long time without children. And so it was like a huge adjustment to just have a baby come in and kind of flip everything upside down.
Right. No, I'm an overthinker too, so I can totally relate to that.
Yeah.
And also when we are trying to have a baby, there are a lot of comments. I mean, it could be from immediate family or it could be from the peer pressure. So there's always a question of when are you going to have the minute we're married.
Oh, yeah.
The next question is when are you going to have a baby? And they don't even know the full picture of what the couple is going through.
Yeah.
So having a supportive husband is one part, because I generally tell them that it'll happen when it happens.
Yeah.
Because there was a line where when I saw your husband, you had mentioned that your husband would generally say that it'll happen when.
Yeah, he was unfazed by all it was especially his family that asked a lot. Like I remember the first Christmas after we got married in July, and then we went up to Edmonton to see his family that first Christmas, and when we were leaving, they said, next Christmas, you'll bring a baby with you.
Oh, yeah. Oh, yeah. Oh, yeah.
And so that was the assumption. And then, every Christmas after that for years, no baby, right? And so they would keep asking. And he was really great, actually. He was very he's like, whatever, don't listen to them.
But did that take a toll on you?
I mean, it did a little bit, just because people kept asking.
Right.
But I also, again, wasn't
Understood.
really, wanting it a lot, know, and so I kind of thought, it's okay. When it happens, it will happen.
It'll happen. Right. Yeah. And then there's a pregnancy phase, which just happened. Scarlet happened.
Yeah.
And then the labor, because when I was reading your book, 30 hours of labor and 8 hours of pushing is no joke.
It was. I actually had a nap. They let me sleep in the middle after I got my epidural. I was in labor, and then they're like, you need to rest. You can't keep pushing like that. And they let me sleep for a while and then resume. I was like, how can this possibly take this long? But for some people, it does.
Right. And also the 3 days being in the hospital, again, there's a lot of ambiguity. You had no idea what was happening.
Yeah, it was our first. And so it really was we had no clue it was a weird time here in the Alberta health system. Like they were just overrun with babies like that year. Like we knew when I was pregnant, I knew like 7 or 8 other women who were pregnant and due within the same month as me. And so, and when we got to the hospital, they had run out of room actually in labor and delivery, and so they were actually moving women to different units because they had extra beds there. And so after the delivery and I had some complications, there weren't enough nurses to tell me what was going on. Like we knew something was wrong. We knew they were keeping us there so that they could monitor me and my iron levels because I had lost a lot of blood. But they never communicated anything else. Like I didn't know what the level should be at. I didn't know from day to day when they would let me go home.
Especially being the first time mom, like it hits hard because we don't know what to expect, right? Also, it's a birth trauma, which we don't talk about it much. A lot of women out there also go through, it could be frightening, traumatizing. So to someone who went through such a process and who's feeling extremely low, from your experience, what do you want to tell them?
I think just go easy on yourself. Like it's very easy to think that things should happen a certain way and that you should have certain feelings about becoming a mother, like because everything on TV or in commercials kind of tells you like, you know, the minute they put a baby in your arms, it's like all joy and no, you know, nothing else. Like you're just full of love. And if you don't feel that right away because you went through some birth trauma or you just don't because you're weirded out because your life is changing, then those feelings are okay too. And not to put kind of
too much pressure
or guilt on yourself for not doing it right.
So that pretty much, I guess, it takes a mental toll.
It does,
on them, right? Yeah. Also, like, again, going forward, once we've given birth, the next is the breastfeeding challenge. Because I still remember, like in one of my earlier episodes that I told them that I was telling the lactation consultant that, anyway, it takes 2 to 3 days for the baby to actually, like, understand how the breastfeeding works, even for the mom. It's a slow process. And the milk is not going to, like, it's not going to come out. And there's so much, like, it feels so overwhelming.
It does. It's, you know, before having a baby, like, again, it's, you know, TV, books, whatever. The culture makes you think that, like, oh, babies are just born knowing how to do this. And your maternal instincts kick in and it looks so easy. And you realize, no, there's so much to it, and it doesn't always work exactly the way it's supposed to, and some babies have trouble like latching on, and it can get really painful, and then, you know, if you were like me, because I had lost a lot of blood, I really wasn't making much milk because my body had been through too much.
Yeah. So again, like trying different positions, and when nothing worked, like when you finally decided to go to the lactation consultant. So, and then there's a lot of overthinking which happens when you actually decide, okay, I've been going through a lot and there's nothing left in me for me to give. And when was that moment that you actually decided, you gathered the courage to tell your husband that I can't do this anymore?
Well, we were driving to the lactation consultant. This was like within a week of Scarlett's birth, and we had already gone home. But I just knew, like, I needed to sleep. I needed to take one thing off my plate, and I felt really conflicted about it because, you know, throughout birth, they tell you breast is best, like, and post birth, they really hammer that in, and I knew that it wasn't, I wasn't sure I was making the best decision for my baby, but then I had to for myself, and
Also, the lactation consultant, you had your own fears. What?
Yeah, I thought she would be kind of like, no, keep trying. And she was like, the first, I wrote in the book, the first health professional who really like listened and could really see what I was going through. And she's like, no, you can, like, you don't have to do this.
Right. And how did it feel to get that validation and to be seen?
It was lovely. I don't know who she is. Like, I don't even know what her name was, but it made all the difference. Like, and again, I talk about in the book, I'm still not sure. Even to this day, I made the best decision for my baby. But you know what? It was the best decision for me, and it kept me sane, and a sane mom is good for the baby.
Right. No, it's very true, because the mom's mental health is really important, because the baby needs the mom pretty much like 24/7.
Yeah.
So if our mental health if it takes a toll, then that's going to impact the baby as well.
Yeah.
And another thing is about the body after baby. You very accurately described like the swollen feet. And it could be the hemorrhoids.
Yeah.
Or we even look pregnant like for a few months.
Oh, yeah. Your stomach is never the same again, actually.
Right. I was like, I just gave birth, and why does my stomach look the same? Like 4 or 5 months pregnant.
Yeah.
So the body, again, identity loss is something which a lot of women go through, especially with social media. When we scroll, all that we get to see is all these influencers who post pictures of like having those abs in
Like
full tone.
bikini bodies after, I don't know.
Bikini body at the end of like 7-8 weeks. So for someone who's actually going through a lot, like physically, mentally, emotionally, seeing that it again, like it takes a toll.
Yeah.
So what, like for someone who's listening to this episode and who feels that, oh my God, like my body does not feel the same, like pre and post pregnancy. So what reassurance that you...
My body did go back after a while, but yeah, it does feel weird. It feels weird to be when you feel strange in your own body, and again, it's all about being patient with yourself, understanding that becoming a mother is like a whole person change inside and out, and sometimes it may never go back,
Right.
but you can move forward as a new person. Like,
So the time will heal, basically, I guess.
I think so, and you can kind of rebuild or kind of have a new identity in a way,
Right.
if you give yourself that kind of space to grow and learn and the patience to...
Another thing is the mom guilt. Because I've personally experienced it, where I desperately need a break. Like sometimes I feel like now it's actually getting better because she's more alert. And like you said, we were just discussing about this prior to the recording,
you're
where...
cute, baby.
Thank you. The 6 to 18 months is something which is, we can actually relish with the baby. So I would say even the first few months are really hard. Everything is pretty much a blur.
Yeah.
It just goes, like you just like flash of it. But at the same time, the day goes really slow. I was telling you that like there are days where my husband was on pat leave as well. So the day when he had to go back, I was like, oh my God, you're going back. How am I going to handle? How am I going to handle? Like, I don't, and she used to cry with me a lot.
Oh, yeah.
So I didn't know how to handle it. At the same time, I didn't want others to know that she cries a lot with me.
Yeah.
I mean, like, I don't want people to
That would
judge.
that would make you feel terrible, right? Like,
The instinctive, like, the mom has to, the baby has to instinctively have that
bond
connection
and
with
feel
the mom.
comforted. Yeah.
So talking about the mom guilt, where again, you just told that breastfeeding more so, it was for your sanity that it was a decision, it was the best decision which you've taken. But it did take a toll on your emotional health, where when the baby was having eczema, or when she was spitting up.
Yeah.
So you started feeling that, oh my God, so I was being a little selfish. Is that the reason why the baby is going through that? So like when looking back now, not as someone who's going through that, but now like having survived that, and it's been few years now. So looking back, what do you want to tell that self?
Well, I mean, mom guilt does not go away.
Right.
It just morphs and changes and kind of goes with you throughout your life. But I'm going to repeat myself a lot, though. It's like, take it easy on yourself. Like, there's never you can't do everything perfectly.
Right.
There's just no way. You're always gonna, sometimes you'll make great decisions, sometimes you'll make bad decisions. Sometimes things will go your way, and go as planned, and sometimes they won't. But as long as like you can share love with your baby, that's all they need. Like,
Right. To just keep telling themselves that this will pass.
Yeah, it will pass, and there's no point in feeling extra guilty about anything, because you're just gonna, again, drive yourself crazy.
Because I get told that a lot. So whenever I share that with few of my friends who've got kids who are in their toddler age, 4-5-year-old.
Yeah.
So when I tell them that, how did you go through that? Like even the pregnancy phase, there are few of them, they are like, I love being pregnant.
Oh yeah, some people do. I don't get it.
They do. So I couldn't have that instant connection with the baby. It was a gradual process. Like until I saw, even prior, like before delivery, I would ask my husband, I'm like, okay, so I understand. But the baby is inside like my stomach. So I should be the one like jumping with joy. But it's not sinking. It's just not sinking in for me. So for him, he was like, the minute he said that we got a car seat prior to the delivery, and he was like, when I adjusted the car seat, when I put that in the car, it kind of sunk in that, okay, we are going to have. Yeah. So I guess it's pretty much for me, again, like now it's been 6 months. Now I'm like, okay, now more and more when she wants me, I'm like, okay, now the connection is slowly building day by day. Yeah. So growing with that. So talking about the cultural silences, South Asian, also I guess Asian, it's pretty much there's an overlap in a lot of practices that happens. And again, for example, postpartum, like how you have like a 40-day.
Yeah, it's a confinement
thing.
Stay at home and you don't
stay at home. Even for us, it's pretty much with respect to diet more so. You're not supposed to eat a lot of, for example, tamarind or yogurt in the night.
Oh, interesting.
Yeah, like so they believe that whatever I eat, it gets passed on to the baby. Okay. So how did, for example, in your like whatever that you went through with respect to the cultural. Culturally, whatever was involved.
Yeah, I mean, in Chinese culture, you stay at home for the first month after your baby is born. You don't go anywhere. Although in Western society, like you have to go to the doctor, or whatever, right, do your appointments or whatever. But and then my mother cooked some special foods too. Like they're supposed to be extra healing, and so they involved a lot of ginger and pig's feet. Right.
But did that take a toll? Like again, like with a lot of.
I mean, the isolation did a bit. Like you're not really even supposed to go outside, and you're supposed to not wash your hair too. But I didn't do that.
Right.
But and so there were times that I snuck out. Like I went for a walk around the block because I needed, to get out of the house. Like.
No, that I pretty much, it helped me as well, because when my husband started going back to work, we have a dog as well. Right. So I was so scared, how am I going to manage? There are times where, okay, I need some fresh air. Yeah. So maybe the baby also needs some fresh air. Mm-hmm. But I was so concerned, how am I going to handle like the dog?
A dog and a baby. And
the baby. But
going anywhere with a newborn is just a whole thing.
But I just decided, like one day I was like, no, I need some fresh air. This is taking a toll on me. And the time is just not going. The time is just so slow. So I just pushed myself and it pretty much helped. Yeah. So when I was reading that line that actually when you started walking and getting some fresh air that actually help with your mental health as well. So that I totally agree with, because that pretty much helped with my mental state as well. Also, gathering your thoughts and putting that in the form of images or visual representation. So was that more like a coping mechanism of what you were going through?
Well, no, because I didn't write the book for a long time after having my kids.
Okay.
So I came up with the idea for the book after a year after my youngest. Like Scarlett's my oldest.
Okay. Right.
And so my youngest was born. So I had 3 kids in 5 years, which was the whole thing. and then I had the idea for writing this book and drawing the pictures, and so I had a long period of I'd gone through counseling with my second. I had gone through even more counseling.
Right.
And so all of that was resolved before I sat down to actually write.
Right.
But it did feel healing in the sense that it kind of brought everything full circle. And those images and the thoughts in my head now were out of me, and they're in the book. And ever since then, it kind of, I don't think about it very much anymore because of that.
Right.
So
whatever you were going through, it's pretty much transferred to the
it's
transferred to the book,
Yeah.
and it pretty much helped you with healing.
I think so, or it kind of gave closure. I think is the main thing.
Understood. So again, talking about asking for help, it's just a 4-letter word, but it's so difficult to ask for help. We pretty much think that it's a weakness. So when you were going through a lot, initially a lot of us think that it's just baby blues, because I used to Google, I feel low all the time, what is it? So, and then the Google says that, or ChatGPT says that it's just baby blues. It'll go back, you'll get better in 2 weeks. But when did you understand that this was not baby blues? It's much beyond that.
I mean, I suspected it very early on, and I brought it up with my family doctor, who kind of said, no, it's just the baby blues.
Right.
But, after in Canada, you have a 6-week checkup, or in Alberta. And so at the 6-week checkup, I said with my obstetrician, I was like, I don't think it's just the baby blues.
Right.
And then she had kind of a checklist.
Right.
Asked a bunch of questions.
Right.
She's like, I think you have postpartum depression. And I was so relieved.
That helped,
because I knew it was more than that,
right.
but no one would validate that until that point.
Right.
And so I actually started on medication fairly soon after that, and then managed to get in to see a therapist, a psychiatrist, to kind of do counseling. And again, having that actual diagnosis was
helped.
Very meaningful to me, because before that it's just kind of this fog in your mind and a jumble of feelings and thoughts and guilt and whatever, and to have it kind of explained, and to also understand that there was treatment for it and kind of hope to get out of it was really important.
Yeah, a lot of women, first, they don't understand what's happening. So even when they want help, again, it's considered as a taboo, baby blues, or even if you tell, what I'm feeling is not baby blues, it's much beyond that. So I need help.
Yeah.
Again, culturally, it's not taken in a right way. They end up telling, no, it's not. I mean, you're just overthinking. It's nothing. It's just, you've just given birth. You should feel happy. Don't think about that. Don't think about all that.
Yeah.
So for someone who's just so hesitated, they want help, but they just don't know how to get help, what do they have to do? They should talk to someone who'd help them. What would you tell them? What helped you?
I was lucky because I could talk to my husband, and I know that not everyone can, but he was the first person I asked for help. And he kind of when he realized that I needed more help than he could give, kind of kicked into gear, and he actually hired a postpartum doula, to come help with taking care of the baby and to kind of just show us some strategies, I guess, and that kind of thing. And so, but yeah, just talk to someone you can trust, like whether that's a friend or your mother or
anyone who'll understand.
I mean, hopefully your doctor would be better than mine, but or your doctor. I think it's getting a little better. When I first was writing this book, I remember going on Amazon and looking for memoirs about postpartum depression, and there were maybe 2 others, and one was Brooke Shields, which is not quite as relatable because she's a famous person, and ever since then, though, there have been lots, more and more. So I feel like culturally, at least in the West here, people are more willing to talk about it, and I've seen storylines on TV shows or movies about it, and so I hope. I hope people feel like it's less of a taboo and less stigmatized, and that if they voice their concerns, that someone is more willing to accept it and help too. Right. Because people are more just aware of postpartum depression. And kind of culturally as a whole, it's more accepted. This is... some women go through this, and we should be helping.
Right. So also, again, talking about culture, we rely on family, like the immediate family or friends. But again, the opportunity or the advantage of living in the West is that there's a lot of support, especially if it's a nuclear family. There's a lot of support, like postpartum doula that you said. The AJ that you mentioned in the book, she's great. Yeah, someone who could help you such that you can breathe. You can take a break, you can reset yourself. But a lot of them are not familiar about the help that are available right now. It could be a postpartum doula. So how can they reach out? The importance of, so if I could just ask you, in your case, like the husband was kind enough to just find, there's something called a postpartum doula. So how important is reaching out for help other than just family?
I think it's great if you can find out ways, places that can support outside of family. There, when I went to that obstetrician at 6 weeks and postpartum, and she diagnosed me with postpartum depression, she had a brochure for a community organization called Families Matter here in Calgary, and she's like, call them and see if you can get some support there, because they had group counseling or, just support, or they had a respite care too option where they would basically send someone to your house to watch your baby for 2 hours so that you could take a nap, that kind of thing. And I didn't use that, we ended up going with the postpartum doula. But it was important to know that stuff existed. And I think in most, mid-sized cities, you're probably going to be able to find different organizations that will support you. And they had also support groups for dads. My husband ultimately didn't go to one, but for some people, I'm sure it's really helpful.
Right. I guess they should have this conversation even before delivering a baby.
Yeah.
I guess ideally, because prior to delivering the baby, the entire conversation is how are we going to bring this baby out? Especially if it's a first time. At least second, we at least know this is pretty much, we have a manual of what happened earlier.
Yeah, no, they don't really talk about that, right? They walk you up to delivery, and then it's a big blank after that. And they really should say more about what happens after.
Also, the classes which we enroll, it's all about what happens physically. No one talks about the mental health of what a mother might go through. Yeah, so I guess also being a part of support group, there were times where I would just went out to him
Yeah.
and he would try his best to like comfort me saying that, no, it's fine. Like you talk to me.
Yeah.
It's just a phase, but it just didn't help me. I was like, but you didn't go through it. I'm the one who's.
Yeah, it's very different for the mother, I think.
So
and as much as supportive as fathers can be, they will never completely understand what happened. Like,
And I needed that validation. I wanted to hear from someone who went through that, such that when they tell me it's normal,
yeah,
after postpartum, your body is not going to look the same,
yeah,
but it will heal. You're going to look absolutely fine,
yeah,
and time will heal. I wanted to hear that. And trust me, your book pretty much, it's like whoever wants that validation or a friend you're like a friend. This book is pretty much like a friend.
Oh, I'm glad.
Yeah, it's like a postpartum guide, like especially like nothing about physical healing.
Yeah.
It's all about the mental healing. So I guess this will be really helpful, especially the visual representation. Reading is one part, but when you represent something with like illustrating something, it pretty much like resonates with you immediately. When you look at that, okay, I was like that. I was sitting there like on the couch.
Yeah. And I like, someone once told me, and I never thought about this when I was making the book, especially making it as a graphic, was also it's fast to read because it's comics and you could read it during a baby's nap,
I did that.
Whereas I remember the first year with Scarlet, I read one book like the entire year because there was never any time, right?
No.
And so, I loved that she said that, because it's like, it's a book made for mothers, like who can kind of get in some reading, in between times.
Also, I like the humor that so it's not serious. The topic is serious, but you've added a little bit of humor to it such that, it's more lighthearted. It makes me feel better.
I'm glad. I think even in the darkest of times, like if you can find a little bit of humor, absurdity, even, just to lighten things up, that helps,
Right. And when I was going through the book, part of the sections where you have mentioned that the second pregnancy got slightly better. And when Scarlett was 8 months, you were pregnant with the next kid.
Yeah.
And it was initially, it was okay and it was getting better. But again, when you were alone with the kid and husband had to go back to work, it was pretty much going through it all over again.
Yeah.
So how did each of your pregnancy shape the way that you are today?
I'm not sure. I've never thought about that. So I had postpartum depression with both my first two, and then not with my third.
Right.
And I feel like it's probably made me, at least with my third, it made me a more relaxed parent with my third, because like I'd gone through these really tough things and kind of made my way through, and I had a lot of counseling and kind of knew better how to deal with my thoughts, and how not to kind of let the thoughts kind of drag me into that dark place.
Right.
And I feel like that probably has carried on, even though I didn't have children after my third, and has kind of affected my life in a good way ever since, because like I know how to talk to myself better, less of that negative self-talk, and also how to give myself like grace and
right. Not to take everything seriously.
Or not to feel like everything is like on me all the time, and that I can't like make mistakes or fail sometimes.
Right.
And that the kids will be okay,
Right. Right.
like to relax and kind of just enjoy them instead of worrying about, whether they're getting enough protein or that kind of thing.
Right. So self-care is pretty much important. There are times Right. So there are times where we end up thinking that we are being selfish. We're not taking care. We are putting ourselves first.
Yeah.
And while we should be doing that to the baby. But when did you realize that survival is also important? Is it like when over a period of time it was pretty much a learning that
Yeah, I mean, I don't think I really crystallized in my mind till I drew
Understood.
that scene in the book about, how on airplanes they tell you
yeah.
to always put the oxygen on yourself before
Yeah.
you help like your kid or someone else, because like you're no use to anyone if you,
Right.
if you don't have oxygen,
Right.
and that has always stuck in my mind ever since, like, and that it relates directly to self-care,
Right.
that you need to, like, yeah, you're no good to your kid if like you're a mess inside because you haven't been taking care of yourself. Like,
I heard that line yesterday because the first time we're traveling with the baby.
oh right, yeah.
So it was the first
You're on
time
the
and
airplane, yeah.
so she was just explaining all the protocols and procedures and she was like, during evacuation, you need to put the oxygen mask first.
Yeah.
I was like,
Yeah, your instinct would be to like help your baby first, but that's not gonna help her. you know?
right, right. So yeah, so that kind of, that's when I realized that, okay, so we need to be healthy. We need to be perfect for us to ensure that the kid is, so when we are taken care of, the kid is automatically, she will be taken
Yeah,
care
you're
of.
better
and-
equipped to take care of
Right,
your
right.
baby. Yeah.
So that pretty much takes us to the end of this episode. Thank you so much for sharing your story and sharing all your wisdom and
Oh,
whatever
it's not
helped you.
wisdom, it's just experience. And
Yeah, so whatever just helped you. So whichever phase you are in, and if you have just delivered a baby and if you're feeling really bad about your body and looking especially like those social media influencers, no, so every experience, every journey is different and it will get better over time. So don't be hard on yourself. So thank you so much for watching. And if you haven't read this book, if you're fresh out of postpartum, if you've just delivered a baby, or even if you're pregnant and want to understand how it's going to be in a very raw form, nothing sugar-coated, unfiltered version, I feel, and this is not a promotion, genuinely I read this book, and I'm telling you, it kind of resonated with me. So I'm pretty sure that this will help you, and it'll pretty much like a friend next to you. And thank you so much for watching. Until next episode, another guest. See you soon. Thank you.